And tonight we are back to having 3 highly effective vaccines in the fight against coronavirus. The CDC lifted its 10-day recommended pause on the Johnson & Johnson shot, and it is adding a new warning.
Of course, this all comes after several cases of an extremely rare blood clotting condition in women who received the shot. The CDC says out of nearly 8 million shots given, it has reports of 15 cases, and 3 of those women died.
Good evening and welcome to Denver 7 News at 10. I'm Ann Trujillo.
And I'm Shannon Ogden. Thank you for joining us tonight. So, what does this mean for you and our state's vaccine rollout?
Denver 7's Addie Guajardo is breaking it all down.
The vote is 10 in favor, 4 opposed.
Just hours after CDC board advisors voted to resume the use of the Johnson & Johnson vaccine, the CDC and the FDA lifted the pause. It comes 10 days after halting the use of the Johnson & Johnson shot due to rare and severe blood clots.
Both agencies have full confidence that this vaccine's known and potential benefits outweigh its known and potential risks in individuals 18 years of age and older.
Under the new rollout, labels will include a warning for a rare blood clot syndrome for women under 50.
The FDA and CDC have concluded that the possibility of this so-called thrombosis-thrombocytopenia syndrome occurring is very low.
Out of nearly 8 million doses, 15 cases of rare blood clots have been reported. 13 women under the age of 50. 3 have died. 18-year-old Emma Berkey is one of those 15 cases. She had several seizures and needed 3 brain surgeries. She's now out of a coma, and her family continues to encourage people to get protected.
They do believe that people should get vaccinated.
The FDA says shots can start going into arms as soon as Saturday.
The potential risk from this is incredibly rare. It is not zero, but it's incredibly rare.
Dr. Michelle Barron, the Senior Medical Director of Infection at UC Health, says it boils down to making an informed decision.
The risk of you having this complication versus the potential risk of getting COVID right now certainly is on the side of getting COVID, just again because variants are present, they're more infectious, and resulting in more hospitalizations.
The Colorado Department of Public Health and Environment announced the immediate use of the Johnson & Johnson vaccine. CDPHE says there's about 73,000 doses of the Johnson & Johnson vaccine at 129 locations ready to go into arms. Prior to the pause, Centura Health gave out 13,500 Johnson & Johnson shots. They paused the use of the vaccine days before the CDC announcement after 11 people reported adverse reactions during a mass vaccination event. In a statement, they say they're in the process of reviewing the decision before resuming the use of the vaccine. Addie Guajardo, Denver 7.
And the vaccine fact sheet now includes a section about the risk of blood clots, especially in women under 50. And it warns you to be on the lookout for symptoms like chest pain, leg swelling, and blurred vision.
And the CDC is now recommending the shot for pregnant women. A study published in the New England Journal of Medicine flagged no significant safety concerns for moms or babies. Early trials of the vaccine didn't include anybody who was pregnant, so there's been limited information up to this point. But researchers say they plan to follow up and check the long-term safety of the vaccine during pregnancy.